In the last video, Dr. John Hayes talked about catheter ablation for atrial fibrillation. In this video, we'll be talking about planning for your procedure, the changes that you will need to make before coming into hospital, what you will do during the recovery period, and what you can expect over the first few weeks after the ablation admission. Your doctor will give you specific instructions about your medications, but what will typically happen is that on the day of the procedure you will probably miss your anticoagulant, even if it's just one dose. You will be fasting for a general anaesthetic in most cases, so you will need to have avoided having breakfast on the day of the procedure. We need you nil by mouth for at least 6 hours prior to the procedure commencing. After the ablation, if all goes to plan, we will usually have you being discharged the following day. You will need to have someone drive you home as your leg will still be a little sore and you might be a bit tentative in terms of your driving ability. Most people will have at least the rest of that week off work, even if work is just a desk job or clerical in nature. For those though that have a more physical job, you will have specific instructions given to you about the time frame that you will require off work. That may need to be some weeks. As far as driving though, it's usually only a matter of 48 hours after the procedure that we would say that it is best that you don't drive. Managing atrial fibrillation is a little different from simpler rhythms in the heart, and often patients are surprised that things might not be absolutely settled immediately after the ablation. It's common to expect at least some short-term rhythm instability. The atria get into bad habits when they've been fibrillating, and so patients who have been in AFib for longer periods of time can often expect a little more instability in this early, what we would call remodeling phase. When it comes to reporting of atrial fibrillation outcomes, you will see comments made about a blanking period after the AF ablation procedure. This blanking period refers to this period of time up to about 3 months typically, during which a recurrence of atrial fibrillation doesn't necessarily seem to predict failure of the original procedure. During this period of time, we try very hard to maintain good rhythm. In the same way that atrial fibrillation can beget AF, and more AF episodes tend to lead to more AF episodes themselves occurring, good rhythm begets good rhythm. And so we will potentially have to maintain medication to ensure rhythm stability during that time. And if atrial fibrillation returns, it may be that we would even need a cardioversion to put things back on track. None of this is of great concern, and as we get further and further out from the procedure, it will become clearer whether we're making good progress or whether further adjustments may need to be made. In the next video, Dr. Thomas Walters will be discussing what happens on the day of the ablation procedure.